Hello, my name is Rachel Saputo Abarca, manager with Blue Cross Blue Shield of Michigan. Welcome to today's presentation. Our presentation today will cover Medicare basics and how Medicare works with your retirement system medical plan. Key terms in understanding how your medical plan cost share works, your 2024 medical plan updates, choices for convenient care, how to get the most value from your medical plan, and resources to help you succeed, including how to contact Blue Cross. Throughout the presentation, you'll see Medicare-specific terms and benefits shown in purple and non-Medicare-specific terms and benefits shown in orange.
Navigating healthcare can be confusing, especially for members who are becoming Medicare eligible due to disability or soon to be celebrating their 65th birthday. As a retirement system member, when you become Medicare eligible, you must ensure that you have both Parts A and B. Parts A and B together create what is called Original Medicare coverage. If you do not have both Parts A and B, you will not be eligible for your retirement system medical plan coverage. Typically, there is premium paid for Part B coverage only, and that premium is based on income. Medicare Part A is hospital insurance and covers hospital care, skilled nursing facility services, hospice care, and home health care services. Medicare Part B is medical insurance, and covered services include doctor's visits, some preventive services, lab tests, and durable medical equipment. Medicare Advantage, also known as Part C, offers additional medical benefits not covered by Original Medicare. Your retirement system medical plan is a Medicare Advantage plan. This plan combines the benefits of Original Medicare Part A and Part B with the benefits provided by the retirement system to form one medical plan. You must have Medicare Parts A and B to be eligible for your retirement system medical plan coverage. Your Medicare Advantage plan includes preventive services, including 25 exams and screenings covered at 100%, coverage while traveling within and outside of the U.S., and routine hearing care provided exclusively by TruHearing. Remember, once you receive your Medicare ID card, you must contact the ORS as soon as possible to ensure that you are signed up for the Medicare Advantage plan without a lapse in coverage. You should receive your Blue Cross member ID card prior to your effective date. Please put your Medicare ID card in a safe place. Only present it at your provider's request. Your Blue Cross ID card is the only card you will use when seeking medical services with a provider. Your provider needs to bill Blue Cross Blue Shield of Michigan for payment consideration. You want your provider to bill Blue Cross directly, not Medicare. Let's talk about the key terms that are associated with what you pay for covered services and understanding how your medical plan cost share works. Some services covered by your plan are paid in full by your retirement system, but most of the time, you must pay for a portion of the cost of your claims. The amount you pay for covered services, referred to as your cost share, is explained in detail in your benefit guide, which is available to you online. These are the cost share terms you need to be familiar with. Coinsurance is a fixed percentage of the costs you share with your retirement system. For example, for most covered services you receive from PPO network providers, you pay 10% of the allowed amount for the service. Your retirement system covers the remaining 90% of the cost. You can learn more about in-network PPO providers and how using them can save you money in the Choices for Care portion of this presentation. A copayment or copay is a flat dollar amount that you pay for covered health care services. Your retirement system plan has a copay on 3 medical care services: emergency room visits, urgent care visits, and routine hearing care. A deductible is the amount you pay each year before your retirement system begins to pay. Until you reach your annual deductible, you pay 100% of your covered medical expenses. The deductible for Medicare members and for non-Medicare members fully participating in the Living Well program is $800 and will not change in 2024. And up to $1,000 for non-Medicare members that do not fully participate in the Living Well program. You can learn more about the Living Well program in the Get the Most Value from Your Plan portion of this presentation. The coinsurance maximum is the maximum amount of coinsurance you'll pay in a calendar year for in-network services. How it works is that we keep track of the 10% coinsurance you pay throughout the year. Once you reach the coinsurance maximum, you stop paying the 10% coinsurance for the rest of the year. Good news is, just like last year, your coinsurance maximum in 2024 is $900. If you're using non-network providers that are not in the PPO network, you're generally paying a 30% coinsurance. In this case, once you meet the $900 coinsurance maximum, your 30% coinsurance is reduced to 20% for the remainder of the calendar year. The out-of-pocket maximum applies to Medicare members only. It is the most Medicare members pay for claims cost in a calendar year, with the exception of copays for routine hearing exams and aids, which do not apply to the out-of-pocket maximum. The out-of-pocket maximum for 2024 for Medicare members is $1,700, same as it was in 2023. We know that health insurance terms and how things work can be confusing. Now let's take a closer look at how your cost share works. In this example, we are looking at a medical service that requires the member to pay both coinsurance and deductible. The member had a service with an in-network PPO provider, and Blue Cross approved $1,500. As we learned during our review of key terms, coinsurance is applied before the deductible. So let's start by determining the amount this member would owe in coinsurance. 10% of $1,500 is $150. This is shown below the amount you owe in coinsurance. Now let's determine the deductible. In this example, the member's deductible is $800 and they have not paid any money towards the deductible. So we know the member is either on Medicare or is a non-Medicare member fully participating in the Living Well program. Now let's calculate the member's out-of-pocket costs. The member would pay $150 for coinsurance plus $800 towards the deductible. This equals $950. The retirement system would pay the remaining $550. Let's take a look at another example. In this example, the member had a service with an in-network PPO provider, and Blue Cross approved $1,500. Coinsurance is applied before the deductible, which we already calculated to be $150. This is shown below the amount you owe in coinsurance. Now let's determine the deductible. In this example, the member's deductible is $800. So again, the member is either on Medicare or is a non-Medicare member fully participating in the Living Well program. In this example, the member has already paid $500 towards the $800 deductible, thus leaving a balance of $300. This is shown below the amount you owe towards your deductible column. Now, let's calculate the member's out-of-pocket costs. Remember, coinsurance is applied before the deductible. The member would pay $150 for coinsurance plus $300 towards the deductible, which equals $450. The retirement system would pay $1,050. Let's take a look at the changes to your medical plan for 2024. If you are Medicare eligible, beginning January 1st, 2024, your emergency room visit copay will be increased from $125 to $135 per visit. Remember, your emergency room copay is waived if you are admitted to the hospital within 72 hours. If your condition is not a life-threatening matter, please go to your nearest urgent care office. Your copay remains $65 for urgent care services. For non-Medicare eligible members starting January 1st, 2024, your emergency room visit copay will be increased from $125 to $135 per visit. Remember, your emergency room copay is waived if you are admitted to the hospital within 72 hours. Copays for emergency room visits begin after you've reached your coinsurance maximum of $900 for 2024 and paid your annual deductible. This remains the same from 2023. Finally, just like members on Medicare, the emergency room copay is waived if you are admitted to the hospital within 72 hours. If your condition is not a life-threatening matter, please go to your nearest urgent care office. Your urgent care cost share remains the same in 2024. Beginning January 1st, 2024, the following preventive screenings will be covered at 100% in network for our non-Medicare eligible members. This includes breast cancer screenings, cervical and vaginal cancer screenings, prostate cancer screenings, and screening colonoscopies. Outside of the network, you will pay 20% of the Blue Cross approved amount. Remember, your out-of-pocket costs are lower when you use in-network providers. Retail health clinics, also known as pharmacy health clinics, will be covered as a place of service. These locations can provide services and treatment for minor illnesses and injuries, including vaccinations. There are nationwide retail health clinics you may already be familiar with, such as CVS Minute Clinics, Rite Aid, or Walgreens. This means that covered vaccinations can be received at these locations and will be paid by your medical plan for our non-Medicare eligible members. Starting January 1st, 2024, all Medicare and non-Medicare PPO members will have access to virtual care through the Teladoc Health app and website. You'll no longer receive virtual care through the Blue Cross online visits. You'll receive more information in the coming months to make sure you have everything you need to get started on January 1st. Remember to coordinate all care through your primary care provider, and you are not limited to the providers available through virtual care. You can also receive primary care provider and behavioral health services online or over the phone directly from a network provider that offers telehealth services. When it's not an emergency, you have smart choices for convenient care. With the 24/7 nurse line, you can talk to a registered nurse at no additional cost, day or night, and get medical advice. The 24-hour nurse line can help you decide if you should head to the doctor or schedule an online visit, pick up over-the-counter medications, or simply get some rest. Call 1-800-775-BLUE or 2583 and listen to the prompts to speak to a nurse. TTY users should call 711. Having a good relationship with your doctor is important. A primary care provider, or a PCP, is a doctor of internal medicine, family practice, or general practice. Typically, this is the physician that you see the most. Your PCP gets to know you, your medical history, and lifestyle so that they will be in the best position to perform your regular checkups, refer you to specialists, or coordinate any necessary hospital care. They monitor the big picture of your health. And if they are an in network primary care provider, they may also save you money. Visit the key terms and cost share portion of this presentation for examples. The in-network distinction is important when selecting a PCP or any provider. Because these providers agree to accept Blue Cross's approved amount for their services, and the retirement system helps pay for the care you receive. When you choose a PCP, you'll want to focus on providers with a patient-centered medical home distinction, or PCMH. When you choose a PCP that's part of a patient-centered medical home, your PCP leads a team of healthcare professionals who will work together to provide your care. Your PCMH team provides you personalized care plans to help you reach your goals. There are a few benefits you can expect to receive when working with a PCMH doctor, including flexible and/or extended office hours, help with coordinating visits to specialists, training and education to help you manage chronic conditions, and help accessing community resources. If you don't already have a primary care provider, consider choosing one today. This is an essential step you should complete in order to get the most value from your plan. To find a provider in the PPO network, including a PCMH doctor or a participating durable medical equipment or DME provider, visit www.bcbsm.com/find-a-doctor. If you don't have access to a computer, call 1-800-810-2583 and we'll help you find a provider. TTY users should call 711. Whether you see your own primary care provider or need after-hours care, online or in person, you have choices for care that are always there. Our Blue Cross Coordinated Care Program is a comprehensive program led by a nurse care manager. This team works to uncover and manage the needs of our members and coordinates with the other resources on the team to provide personalized support. If you are managing a chronic condition or in need of support navigating complex healthcare needs, our care team is here to assist. To connect with a nurse manager, call Blue Cross Engagement Center at 1-800-775-2583. TTY users should call 711. Non-Medicare members have access to the new Blue Cross Coordinated Care Advocate Program. Advocate is a program that will help make healthcare less complicated. With the Advocate program, your healthcare journey begins by connecting you with a member advocate. A member advocate is a registered nurse who gets to know you and your care needs. You can turn to them with questions like, I left the ER with a recommendation to see a specialist. How do I find one? Or, what prep work can I expect to do before my surgery? Member advocates can help you resolve issues related to your health and coordinate care with your healthcare providers. Make health decisions, help you gain a better understanding of your condition, medications, and treatment options. Find an in-network doctor or provider and schedule appointments. And connect with support and services in your local community. To connect with a member advocate, call Blue Cross Customer Service at 1-800-422-9146. TTY users should call 711. That's Monday through Friday, 8:30 a.m. to 5 p.m. Eastern Standard Time. You have a rich plan that offers choices in care. Now let's talk about how you can get the most value from your medical plan and help keep your costs down. The following vaccines are covered under the medical plan administered by Blue Cross: COVID-19 vaccine, hepatitis B vaccine, flu or influenza vaccine, and pneumonia or pneumococcal vaccine. Additional vaccines are covered under the prescription drug plan administered by OptumRx. Contact OptumRx for more information about which vaccines are covered and any applicable costs. Regularly scheduling an annual routine physical with your primary care provider can help you stay current on your vaccinations. A detailed vaccination guide will be posted on your Blue Cross member portal along with numerous informative documents under the Medical Plans tab within the Plan Documents link. Remember, starting January 1st, 2024, our non-Medicare eligible members will be able to obtain covered vaccinations at a local retail health clinic, such as CVS Minute Clinics. This benefit will also continue for our Medicare Advantage eligible members. Take time to review the comprehensive vaccine coverage guide located in the Learning Center. This guide outlines your medical and prescription drug plan vaccine coverage. You've likely heard about the importance of getting an annual physical. Seeing your primary care provider once a year can help identify potentially harmful health issues in early stages and even prevent them from happening at all. This is also a good opportunity to update your primary care provider on your well-being and ask personal health questions that matter to you. Whether you are Medicare eligible or not, your routine physical exam and standard routine labs are covered once per calendar year at no cost to you in the PPO network. This way, you can have the necessary services and treatments before they cause bigger problems. Something to keep in mind when you schedule your physical is that your doctor may want you to get additional tests that are not covered, like a screening EKG. When a sign or symptom is discovered during an exam, all further testing and exams are considered diagnostic procedures, and diagnostic out-of-pocket costs will apply. Therefore, it's important to ask your doctor in advance what tests are performed with your physical exam. Call Blue Cross customer service to verify if the recommended tests are covered. Living Well is a program for retirees and covered family members that provides you tools to help you lead a healthier lifestyle while rewarding you for making healthy choices. If you're on Medicare, you are automatically enrolled in the Retirement System's Living Well program, which gives you the lowest deductible of $800. Non-Medicare members can earn deductible credits of $200 when they complete all the steps to enroll in the program. To enroll in the 2024 Living Well program, you must complete steps 1 through 3 by December 31st of 2023. The first step is selecting a primary care provider. Whether you're on Medicare or not, one of the best things you can do for your health is to select a primary care provider. Keep in mind that a primary care provider is not a specialist. When you select your primary care provider, we strongly suggest you select a provider that is part of a patient-centered medical home or PCMH. You can learn more about the benefits of using a PCMH doctor in the Choices for Care portion of this presentation. The second step of the program is to complete the Living Well Health Questionnaire. It has a list of questions that can help you and your healthcare provider build a plan for you to live well. The Living Well Questionnaire was mailed to non-Medicare members in October. Step 3 is seeing your primary care provider to get a routine physical exam. The routine physical exam is covered in full in the PPO network. A physical exam you received at any time during 2023 will count towards this step. Non-Medicare members will earn a deductible credit of $150 by completing steps 1 through 3 by December 31st of 2023. You can earn an additional $50 credit by choosing a PCMH doctor in step 1, resulting in a $200 deductible credit. This means you will have an annual deductible of $800 for 2024. Note, this slide is specifically for non-Medicare members. Medicare members, you already have the lowest deductible, so the Living Well program doesn't affect your cost share. However, we strongly encourage you to get a routine physical exam to help maintain or improve your overall health. Looking to kick your exercise routines up a notch? Non-Medicare members have access to physical health and fitness programs through Blue 365. Check out exclusive Blue Cross member discounts today by logging into your Blue Cross online member account and click Member Discounts with Blue 365 on the homepage. Medicare members have access to the Silver Sneakers Fitness program at no additional cost. Silver Sneakers has fun and energizing fitness programs that help you take greater control of your health by encouraging physical activity and participation in social events. It's designed to improve your overall fitness by increasing muscular strength, endurance, flexibility, agility, and balance. There are a few sample classes available in the Learning Center. Medicare members can attend workout classes in person, watch classes and workshops online, and participate in local community health and well-being events. If you need help signing up or have questions, visit www.silversneakers.com/start here or call 1-866-584-7352 Monday through Friday, 8 a.m. to 8 p.m. TTY users should call 711. Your routine hearing benefit remains the same for 2024. You have a comprehensive routine hearing care benefit, which includes a routine hearing exam and a variety of hearing aid options once every 3 years. Hearing aids are categorized as advanced or premium based on the level of technology selected, and you pay a copay per hearing aid. Both True Hearing Advanced and True Hearing Premium now have the option of rechargeable aids. The True Hearing benefit also includes a 60-day trial period, 80 batteries per aid, 1 year of follow-up visits, 3-year full manufacturer warranty on all devices, and no-cost online hearing screenings 24/7. Remember, routine hearing exams and hearing aids are only covered through this program when you call True Hearing at 1-855-205-6305 and follow the instructions you're given. TTY users should call 711. As a Blue Cross Blue Shield member and busy retiree, we know that convenience is important to you. We're continuing to develop and update our tools to make accessing your benefits and well-being resources easy, useful, and personal. We've talked at great length today about your retiree medical benefits, programs, and cost. Whether you'd like to get tips on trying to control your diabetes or want to find healthy recipes, there's loads of valuable content online at www.bcbsm.com/MPSERS. Our site makes it easy for you to manage your medical plan online. Here are just a few things you can do on the website. You are able to view your 2024 annual documents. This includes your annual notice of change, evidence of coverage, summary of benefits, resource guide, and your member benefit guide. Attend webinars or watch presentations that can help you better understand your plan and explore health topics. Find a variety of resources to help improve your overall health, and get health and well-being discounts exclusively for Blue Cross members. An online member account lets you choose what's best for you. Once registered, you'll have the tools, information, and support under one secure online account to help you understand your plan, how it works, and what is covered. Once you are logged into your online account, select My Coverage to view your covered benefits and the 2024 annual benefit documents, such as the Summary of Benefits and Resource Guide. Select My Claims to know what services providers charged you and the costs covered. You'll want to use this information when reviewing your EOB. You can also sign up to receive your EOBs electronically. Select ID card to view, print, or order a replacement member ID card. If you're at the doctor's office without your Blue Cross member ID card, just log into the mobile app, pull it up, and present it to the office staff. Select Find a Doctor to search for PPO and network providers and directions to their office. If you don't have an online member account, it only takes a few minutes to register. Visit www.bcbsm.com/register and select Register Now. Once you have created a log-on ID and password for your Blue Cross online member account, you'll use the same information to access the Blue Cross Blue Shield of Michigan mobile app. You'll see the same information when you log in to your member account on the website. You also have access to a virtual member ID card, health and well-being resources, Blue 365 member discounts, and a cost comparison tool, which is currently available for non-Medicare members only. When using the Blue Cross mobile app, your medical benefit information stays with you wherever you go. If you need help with downloading the mobile app or using the mobile app, call the app support team at 1-888-417-3479. TTY users should call 711, and that's Monday through Friday, 8 a.m. to 8 p.m. Eastern Standard Time. Medicare and non-Medicare eligible members enjoy access to the Best of Health newsletter. This publication is created special for our Michigan Public School retirees and is published quarterly. You can find the Best of Health library online at www.bcbsm.com/mpsers/4-members. It is also available by email. Your Best of Health newsletter includes information from the Michigan Office of Retirement Services and each of your health plan vendors. Topics consist of health plan coverage, nutrition, fitness, health, and well-being resources. Stay informed by exploring your Best of Health archives online today. If you have questions about your retirement system medical plan, call 1-800-422-9146 Monday through Friday, 8:30 a.m. to 5 p.m. This number is also located on the back of your Blue Cross member ID card. You can also find plan information online at bcbsm.com/mpsers.
Remember, if you have pension payment questions or need your address changed, you'll need to log on to your ORS My account to make the change or contact the ORS by phone at 1-800-381-5111. TTY users should call 711.